Hello everyone and welcome. Today's presentation is hosted by the Assistant Secretary for Technical Policy, Office of the National Coordinator for Health Information Technology, or ASTP, the Office for Civil Rights, and Altarum. The Assistant Secretary for Technical Policy, Office of the National Coordinator, or ASTP, is at the forefront of the administration's health IT efforts and is a resource to the entire health system to support the adoption of health information technology and the promotion of nationwide standards-based health information exchange to improve healthcare. The Office for Civil Rights, or OCR, ensures compliance with our nation's civil rights, conscience and religious freedom, and health information privacy and security laws by investigating complaints and conducting compliance reviews, requiring corrective and remedial action, promulgating policy and regulations, and providing technical assistance and public education for the American people. Altarum is a nonprofit organization that works with federal and state health agencies and foundations to improve health outcomes. My name is Ryan, and I'll be leading today's presentation. Along with me, I have Dawn Bishop of the SRA Tool Help Desk, and we also have Nick Heasters from OCR. Nick, Dawn, and I will be available for some Q&A after the presentation as time allows. Please note that everybody here is muted by default, all the attendees. So if you have a question during the presentation, you can use the question box in your GoToWebinar interface, and we will respond to some of those questions during the presentation, and then we may reserve some for after the presentation to address to the whole audience, and we'll do Q&A as time allows. So our agenda for today. We understand that some of you may have used the SRA tool before, and maybe you know what security risk assessment is, but we always have a good number of folks on these webinars who maybe haven't used the tool before. So we're going to start off with some basics about what is a security risk assessment. Next, we'll do an overview of the SRA tool's functionality. Then we'll talk about some of the enhancements that we've made to the tool in version 3.5, which we will be releasing here this fall. And then finally, we'll do some Q&A at the end. So what is security risk assessment? The HIPAA security rule states that a covered entity or business associate must conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information, or EPHI, held by the organization. What does this mean? Well, first, let's talk about a covered entity. What is a covered entity? A covered entity may be a health plan, a healthcare clearinghouse, a healthcare provider who transmits any health information in electronic form in connection with a covered transaction. So this would mean most healthcare providers, including doctors, clinics, hospitals, nursing homes, and pharmacies. And then we have a business associate. A business associate is a person or entity that performs certain functions that involve the use or disclosure of protected health information on behalf of a covered entity or another business associate. The security rule requires covered entities to maintain reasonable and appropriate administrative, technical, and physical safeguards for protecting patient health data. Specifically, covered entities must ensure the confidentiality, integrity, and availability of all EPHI they create, receive, maintain, or transmit. They must identify and protect against reasonably anticipated threats to the security or integrity of information. They must protect against reasonably anticipated impermissible uses or disclosures, and they must ensure compliance by their workforce. I'll talk a little bit about risk analysis. Risk analysis is a component of a security risk assessment that covers assessment of risks and vulnerabilities to EPHI. This means identifying all EPHI within your organization, which is data that you're creating, receiving, or transmitting, identifying all sources of EPHI, including external sources. So these may be your vendors or consultants. And then identifying human, natural, and environmental threats to information systems that contain EPHI. So we're talking about both technical and non-technical vulnerabilities. Your IT resources being infected by malware or unauthorized access, but also natural disasters, flooding, things like that. So when you perform security risk assessment, what are you hoping to accomplish? What are the outcomes of a security risk assessment? Organizations should use information from their assessment to implement security measures to design personnel screening processes, identify and strategize data backup, determine how encryption needs to be used at your organization, determine what authentication may be required to protect your data, and to determine policies and procedures that may need to be created or improved to protect your EPHI. So given that overview of security risk assessment and why we need to do it, I want to talk a bit about the challenge of conducting security risk assessment for small and medium-sized practices. So first challenge is that organizations are vulnerable. Small healthcare organizations are vulnerable to attack and breaches in protocol that could put sensitive patient data at risk. Next, like we heard already, security risk assessment is required. The HIPAA security rule requires that healthcare providers, health plans, and business associates conduct a security risk assessment and implement safeguards to protect their patient data. And finally, small budgets and few staff. There are a lot of healthcare organizations that may have a lot of organizational structure and dedicated staff who are, their job is to ensure strong security posture. There are a lot of small providers who don't have those same resources. And so with that in mind, we created the SRA tool it's an accessible and easy to use tool to help practices identify and assess risks to their EPHI. And we also suggest security measures to help reduce risks. So it's a desktop application that is meant to fit that need of conducting security risk assessment, or at least aid in that process for small to medium-sized practices. Let's take a closer look at the SRA tool. This is not going to be an in-depth discussion of every technical feature of the tool, but this is really a high-level overview. If there's anything you'd like to learn about in more depth, feel free to put your question in the chat. You can also review our user guide or our frequently asked questions on the healthit.gov download site, which I think we can probably distribute a link to here, so those of you can access that. So to use the SRA tool, first we have to download it and install it. So we'll talk a little bit about that. When you're downloading and installing the tool, there are a few basic things to understand. First, the SRA tool can be downloaded from healthit.gov. If you're interested in trying out the tool, again, I think Dawn just put a link in the chat. You can check out that link. Or if you're searching for the SRA tool online, just make sure that you're getting a link to healthit.gov, which is the official website for ASTP ONC. The SRA tool is a desktop application that can only be installed on Windows computers. So any modern computer running Windows 8, 10, or 11 should work, though I think most of us should be on Windows 10 or 11 at this point. You will need administrative rights on your computer to complete this installation. So you may need to open a ticket with IT or get somebody who is an administrator to help install the tool for you if you don't have that permission. For users without access to Windows or who are otherwise unable to install the tool, we do have the SRA Tool Excel workbook that I'll touch on a little bit later in the presentation. And that could be an alternative for you to use if you don't have access to Windows. And the Excel workbook is available on that same link with the desktop application, so that same web page. So you see here, it's a bit of an older screenshot of that download page, but it should still look something like this. So once you're at healthit.gov, to download the installer, you'll double click that, or you'll just click that link there to download version. You'll see it should be 3.4 now. That's the latest version that we have available. And once the installer successfully completes it, you'll download the installer, open it up. It'll guide you through a process. You'll kind of click next a few times, and then you'll get this blue SRA tool icon that should be added to your desktop. And this is what you're going to use to launch the tool for the first time. So we always like to run through this process. I know a lot of folks these days, a lot of things are on the web, so people aren't always as familiar with installing software on the machine. So we like to highlight that. So once you've got the tool installed, let's take a look at sort of the workflow as you progress through the assessment for the first time. When you open up the tool, you're going to see this welcome screen, and it's going to ask you if you want to continue an SRA that you may have already started, or if you want to start a new SRA. And today we'll review the process of starting a new SRA or a new assessment. Once you've determined that you're going to start a new SRA, you'll need to enter your name. And you're entering your name here to help provide an audit trail of who contributed responses to your assessment. So multiple users may contribute to an assessment, and each of those users should log in with their own name. And that way you can see who answered each question, and there's some accountability there. This isn't you're not entering your name for a password or credential. This isn't, trying to lock your assessment down. It's really just for the audit records. Next, the tool will ask you to save your file. You'll need to select a location to save your file. The SRA tool is designed to open and save SRA files, or you might see, if you can see the file extension on your computer, it might say .sra. And this is a proprietary file format, and these files can only be opened with the tool. And I think this is important to understand for anyone using the tool for the first time. You create your SRA file with the tool, and you save it on your own machine or network. And you're going to need to file it away in somewhere that you're going to remember it. So it's really important to put it somewhere that makes sense and somewhere that you're going to remember where you save it for the next time you need to return to it. And I want to note that nothing is saved or transmitted via the web. Everything is happening on your own computer. So that SRA file stays on your own computer, or maybe a network share, and nothing is transmitted to ASTP or ONC or OCR in this process. If you need to work with your assessment outside the tool, your results can be exported to Excel or PDF. So even though the file is proprietary that you're working on the tool, it's only going to work with the tool. There are some portable formats that you can use. Next, we have the practice information section, and there are a few components to the practice information section. I'm going to cover these quickly on a single slide. But practice information is the first section of the tool that you're asked to enter information about your practice. And in this section, The tool is trying to get users thinking about first the physical locations of their organization. So if you've got multiple offices or multiple physical locations, it's going to ask you to document those and then identify some points of contact for each location. Next is your IT assets, which may be computers or network infrastructure, medical equipment, and any other electronic hardware that may have access to or interact with your network or and otherwise interact with patient data. And then next is vendors and business associates, which are external organizations you do business with and may have access to your EPHI. The screens in this section provide basic inventory and relationship management, and some of these screens may be considered optional. For example, if your organization has an IT asset management solution outside the tool, it's perfectly acceptable to continue using that. You don't need to duplicate the work here, but managing and keeping track of your assets is a really important part of security risk assessment. And so the tool does provide a mechanism to do that, and especially for smaller organizations who may not be doing this formally, this could be a really good resource for you to use. If you are going to use an external asset management solution, you can maybe export information from that and attach that to your risk assessment here. There is a documents feature that we'll talk about a little bit later that you can use to upload supporting documentation. Next, we have the assessment section, which is the bulk of the SRA tool's content. Right now, there are 7 sections of multiple choice questions, along with a threat and vulnerability rating component, and then a section summary for each section. The assessment screens are laid out with the question at the top center. You've got your multiple choice response options below. And then on the right, you'll see 2 panes. The first is education, and then there's references right underneath that. The education pane provides guidance related to each selected response. So this information is changing based on which answer you select. So in this example that's here, if you change your answer to no, then that education content there would change and provide you information relevant to your selection of no for this question. And then the references pane provides relevant citations to the HIPAA security rule, the NIST cybersecurity framework, the health industry cybersecurity practices, or HICCUP, or the HPH cybersecurity performance goals, or CPGs, which is a new reference type that we added, or we will be adding in version 3.5 that we'll be releasing later this fall. So that was the assessment section, or the assessment portion of section 1. After you get done with those multiple choice questions, you're going to see threats and vulnerability section. And here you're asked to select from a list of vulnerabilities that may be applicable to your practice or organization. Each selected vulnerability comes with a set of related threats, and you're asked to rate the likelihood of these threats occurring and the impact they would have on your organization should they occur. So we can take a look at the example here on screen. If you look down at the second screen, the one that's in the front here, you'll see that there were some vulnerabilities selected as applicable to the practice. And these vulnerabilities are based on content or based on questions that you just saw in the multiple choice. So section 1, I think, has 10 multiple choice questions. These vulnerabilities are going to be, they're going to tie in very closely to the questions that you saw in that multiple choice section. So the first one selected here was failure to share security procedure information with appropriate parties. And so because that was selected, there are some threats under here that may open your practice up to. And what the tool is asking here is for each of these threats, think about how they may impact your practice. So we're asking you to rate the likelihood. So how likely, given your assessment of your organization, how likely would that threat be to occur at your organization? So you can rate that at low, medium, or high. And then you have to think about the impact. If that did occur, what sort of impact would it have on your practice or organization? And you rate that again, low, medium, or high. So once you've completed all these ratings, you'll click Next, and you'll see the section summary. So the section summary is shown at the end of each section, and it shows each of the questions presented and the responses you selected. And it also provides the education content related to those responses. You'll notice here that the questions that you responded to are divided into two areas. See, there's kind of two halves of the screen here. On the left in blue, you'll see areas of success. And on the right in red, you'll see areas for review. Questions sorted into areas of success are those which represent a thorough and/or accurate assessment was completed and aligns with industry best practices. Questions sorted into areas for review represent responses that could use improvement or need to be revisited in order to increase your security posture. And I just want to point out that questions that are sorted into the areas of success group, that doesn't necessarily indicate that your organization is fully compliant with the HIPAA security rule, but it does indicate that your organization is aligned with industry security standards and the recommended actions that can help you protect and safeguard EPHI. So areas of success indicates that you selected the most appropriate answer, but it may not necessarily indicate that you're 100% compliant. Okay, so that after you're done, so I mentioned that there are 7 sections, so you'll need to repeat that process with the multiple choice, the threats and vulnerabilities, and the section summary. You'll do that 7 times and get through all the 7 sections, and then you'll get to the reports portion of the assessment. And I think most of the reports are actually not available until you've completed all 7 sections. The first report you'll see after all sections are completed. Actually, this one may be available as you're completing it. I don't remember. But this is the first report here is the summary report. And here you'll see some graphics at the top of the screen. There's 3 different charts here. The first one is showing you your risk score, and that's a percentage of questions sorted into areas for review out of the total number of questions presented. So of those questions that you saw, what percent of them did you answer in a way that indicates there's some deficiency there or some action may need to be taken. Next, in the middle there, that's that same, it's really a similar chart, but instead of showing a percentage, that's just the raw number of questions that you answered, sorted into the areas for review. And then on the right, for vulnerabilities, that's just the number of vulnerabilities that were selected as applicable for your practice or organization. Down below, you'll see the risk scores for each assessment section in terms of risk percentage. And this is similar to the risk score shown in that first chart, but it's broken down by section. And it should allow you to see at a glance if there are certain areas or certain sections that you need to give more attention. Next is the risk report. And the goal for this report is to provide a summary of all the areas of risk that were identified during your assessment. So this means that any of those questions that were sorted into areas for review are going to be part of this report. And then also the vulnerabilities that you selected as applicable to your practice. And in this report, the likelihood and impact ratings are combined into a singular risk rating. based on that risk assessment rating key shown at the top of this report. So it's at the top right, so you can see kind of how a low likelihood and low impact may combine to show that low overall risk score. And you just kind of, you can see how those likelihood and impact ratings combine for that one risk rating. And then over on the left is the risk breakdown, which is a pie chart showing sort of the risk level of the threats that were identified during your assessment, and then broken down for those 4 categories: low, medium, high, and critical. And then at the bottom of the risk report, you're going to see all of the areas for review. So the top was really, the top portion was talking about the threats and vulnerabilities, and the bottom portion is pulling out all those areas for review. And here you'll see the question, your answer, the education, and the responses. Next, we have the detailed report, which is a collection of all data captured in your security risk assessment. So that's each question and response, all of the selected vulnerabilities and threats that you rated, all of the assets that you may have entered, your business associates that you recorded, and any notes or details captured in the assessment are all going to be included in this detailed report. This report is also where you're going to see that audit log. So each user who contributed to the completion of the assessment will be shown here with a date and time stamp next to each question that they answered. And then this is the report that we recommend saving. This is sort of the most complete collection of data from your risk assessment, and this is probably the one that you want to save for your records each time you do a security risk assessment. Then finally, we have the remediation report. The remediation report is in some ways similar to the risk report because it's showing all those areas for review. It's pulling out all the questions you responded to that were sorted into areas for review, but it adds some additional space for you to document your response to those areas for review. And it's a place for your practice or organization to document what they're going to do to remediate some of those sort of deficiencies that were identified. You might, if there was something, a question asking about, a certain policy or procedure that you need to have in place, if that's not something that you had in place, well, maybe you're going to assign that to somebody in your organization to update your policies and procedures to include, some new information. And so you can do that here. You can assign an owner to this remediation item. You can assign a due date. You can link documents, and you can also mark it as completed. You document which change you made to your policies and procedures here, just using this text box. Maybe you'll actually link one of those, link the policies and procedures document that you updated, and then you can mark that completed, and it's just a way for you to track your response to items identified during your risk assessment. And this report can be exported as a PDF and printed. So maybe you would print it out as a PDF and then send it to those folks in your organization who might be contributing to the remediation activities. And I'm not sure if I mentioned it or not, but back to that detailed report, this report is also, you can export it to both PDF and Excel. Right. And then we have the SRA Tool Excel workbook, which is a set of interactive spreadsheets containing all of the questions and most of the content from the SRA tool application. So this Excel workbook has all 7 multiple choice sections. It's the same questions and responses that are included in the desktop application. You also see the threats and vulnerabilities here, and they can be selected and rated. And then for the questions, you have the education and references. It's really almost all of the content that you have in the desktop application. And I mentioned that these are interactive spreadsheets. So what that means, if you look at the example shown here on screen, you can see that for that first question, has your practice completed a security risk assessment before? The response here was no. And because that response of no was selected, you'll see that this whole row is highlighted in that light yellow color. And this is really acting the same as the areas for review. So anything that would have been an area for review in the desktop application is going to get highlighted yellow in the Excel workbook. And that just happens automatically. And then similar down here at the bottom of the section, you're rating threats and vulnerabilities, and you're making selections on likelihood and impact. And then this risk score column is using that matrix that I explained on the risk report, and it's combining those automatically into this risk score. So you would get the same results here as you got in the desktop tool. And again, this would be a good solution for those who don't have access to Windows. If you're running Mac, this is cross-platform. You can open this as long as you can open an Excel document. You can open and work with this Excel workbook. All right, so that was a little overview of the tool as it stands today. I do want to talk a little bit about what to expect when you're conducting a security risk assessment. Many users approach the tool not entirely sure what to expect, and that's understandable. And I can't cover everything you should expect, but here's some things you should keep in mind. The first thing you should expect is to spend a significant amount of time completing your SRA, especially if you haven't done one before. There are many resources freely available to provide guidance, some of which are called out inside the tool itself, those references that I mentioned, but this process still requires an investment of time and effort. It's not going to happen quickly. We like to talk about garbage in and garbage out. So if you're rushing through this tool and you're not doing the thorough investigation required to really answer these questions, then your results are not going to be as useful as they should be. So you have to put quality time in to get accurate results. And then the folks using this tool and conducting your assessment need to have a full picture of your risk in your organization. In order to complete an accurate and thorough risk assessment, you should understand your IT environment and how it's used in daily operations and what threats may be facing your organization. It's important to ensure that your scope of risk assessment is inclusive of all EPHI in your organization. So you need to look beyond, it's not just your electronic health records. It may be your practice management software, or if you've got scheduling and billing software, your telecoms, cloud apps, all of the different software that you're running that that has any of your patient information in it needs to be evaluated. And to evaluate that, you need to involve people who have a really good understanding of how those systems are working at your organization. All right. So I'm going to pass it off to Dawn. We have been working this year on some enhancements to the tool. We have a new version that will be released here soon, and Dawn will talk about some of those changes coming to the tool in version 3.5.
Great. Thanks, Ryan. Can you advance to the next slide? So we've gone through the tool a little bit and we've updated and added some new instructions and reminders for help that users can use as they navigate through the tool, including the one that's kind of showing there during the threats and vulnerabilities. It gives a rating scale for the likelihood and impact, just a little guidance to help users understand what the low, medium, high risk ratings might be. And as well as we've added some reminders inside the tool to link documents that are relevant to questions or into the assessment itself. And anywhere that a user sees a blue underlined word, that's where a pop-up will, so there's extra education in there. Next slide. As Ryan mentioned earlier, we did update the NIST cybersecurity framework references to the 2.0 that was updated early in 2024. This replaces the 1.1 framework. And the Cybersecurity Framework 2.0 includes updated guidance to help organizations achieve their cybersecurity goals with added emphasis on governance as well as supply chains. Next slide. We've also added the HPHCPG references, which is the Department of Health and Human Services published the Healthcare and Public Health Cybersecurity Performance Goals, or CPGs. This is to help healthcare organizations prioritize implementation of high-impact cybersecurity practices. CPGs, or the HPHCPGs, have 20 voluntary goals that are divided into two groups. The first 10 are essential goals to help healthcare organizations address common vulnerabilities by setting floor of safeguards. The second 10 are enhanced goals to help healthcare organizations mature their cybersecurity capabilities and reach the next level of defense. Next slide. In the 3.5 version, we've also added cover pages to the exported reports that you can save for later. And the cover pages are going to include the report of the report name, the date, the version number that you're using, the organization or practice name, and as well as this SRA tool disclosure. Right now, we don't have cover pages in the Excel version of the detailed report. Next slide. Also in the 3.5, we've included several new questions that cover organizational threats and vulnerabilities, as well as cybersecurity supply chain risks. And so throughout the assessment, you'll see some content changes, some minor content changes as well, where we were meant to make some questions a little easier to understand and more concise. So that's kind of the overview of what's being released. And now I'll turn it back over to Ryan to wrap us up and cover some FAQs and answer some of the questions that are being posted. Thank you.
Yep. All right. And that version 3.5, like I mentioned, should be available at some point this fall. We do think it'll be pretty soon, probably within the month here. But I assume if you're attending this webinar, you're probably plugged into OCR or ONC, ASTPs, listservs or social channels. And so if you keep an eye on those, look out for notifications about the release of SRA tool version 3.5, so you can be sure to download it when it's available. All right. A few more words about conducting a thorough assessment, because we think this is really important. We want to remind you that this is only a tool to assist an organization with its review and documentation of risk, and therefore it is only as useful as the work that goes into performing and recording the risk assessment process. The HIPAA Security Rules risk analysis requirement specifies that organizations perform an accurate and thorough assessment of the potential risks and vulnerabilities to all of the EPHI the organization creates, receives, maintains, or transmits. For example, when responding to questions regarding passwords and authentication should be considered throughout the organization. It's not enough to just consider Microsoft Active Directory or the password that you use to log into your computers. But you also need to consider how authentication is managed for your network and cloud infrastructure, maybe your hardware. If you've got a server room somewhere, um, authenticating to computer and application administrative accounts, or if you've got remote access set up, especially with a lot of people working remotely these days. There are a lot of different surfaces for risk that need to be considered in your risk assessment. The SRA tool may not assess or address all risks relevant to your practice or organization, and use of this tool does not mean that your organization is compliant with the HIPAA security rule or other federal, state, or local laws and regulations. If risks are known and they're not addressed within the tool, they need to be documented outside the tool, and then you can link them to the tool using the add a document feature or any of the details or comments fields. All right. So we're going to move now into the frequently asked questions portion. And I do have some very common questions here on this slide. But as I'm going through these, I think we'll try to get some of the questions that you all have asked lined up for Nick and Dawn and I to address. So first, how do I upgrade to the latest version of the SRA tool without starting over from scratch? So for this, if you've got version 3.4 right now, maybe you used that last year, and then you're looking to get version 3.5, which we said is going to be released here pretty soon this fall. The installer is designed to go right over top of your previous installation. So you won't really need to do anything. You don't need to uninstall anything. You'll just get that new installer, you'll run it, and then you'll be ready to go using the latest version of the tool. And files that you may have created with the previous version of the tool are still going to work. So if you created something with version 3.4 or 3.3 or 3.2, if the version is 3.0 or later, you're going to be able to open it with version 3.5 of the tool. However, if there were new questions or new references, some of the new things, the HBH CPGs, some of those new questions that Dawn was just talking about, if you want to pick those up, you're actually going to need to start a brand new assessment, because those things won't just automatically be added to your old assessment. So, for that reason, we do recommend starting over periodically, but you can load previous assessments from previous versions with the new version of the tool, and you don't have to necessarily start over from scratch. Next, how do I update the audit date displayed in the detailed report? So that audit date is reflective of when the question was initially answered. So if you are working from an SRA file that you created with version 3.3, I think that would have been a couple years ago now, then if your answer hasn't changed for some of those questions from that assessment, then the audit date is still going to reflect when you first answered that. Now, as you're updating your risk assessment, you're reassessing your risks, you are expected to confirm that all of those answers are still relevant. It's perfectly reasonable that some of your responses won't change. Unfortunately, that audit date will not update. I will say that one of the features that Dawn just mentioned, the cover reports, you may have noticed that there is a date included on those, and that will use the current date, I think the date that you export the report. So, if you're printing out results, you're trying to share the results of your risk assessment, even though the audit date for some of those individual questions may be a little bit older, that cover date on the report is really signifying that, you reviewed all those questions as of this date, and you're confirming that this report is accurate as of that date that you printed out the report. Otherwise, the other way to update the audit date would be to start from scratch, start new, or you can kind of toggle some of the questions back and forth from yes to no or whatever it may be. And if you've changed your answer, then that date will also update. Is the SRA tool available for Apple or Mac computers? And the answer is no. I think we did cover this a bit, but this is a popular question. It's not supported on Mac OS or Linux. You've got to have Windows to run the desktop version of the tool. But we do have that Excel workbook, and that is cross-platform. So that would definitely be something to consider if you don't have Windows. And then finally, does your SRA file or your report need to be submitted anywhere? And the answer to that is no. Your SRA is for your own records. It may be required for an incentive program or one reason or another, but that is all outside the scope of the tool itself. You don't need to submit anything to OCR or ONC, ASTP. These files are for your own records, so they don't need to go anywhere when you're done, and they don't automatically go anywhere. It stays on your computer. Okay, let's see what we have from chat. I'm going to open up the questions here. All right.
Hey Ryan, there was quite a few questions about how two users can be in the tool. Just to give you a head start on reading
Yeah,
through those questions.
that's always a good one. So the tool, yeah, I did mention that you've got that you're recording the name, your name when you're responding to the questions is one of the first things you do. So the tool is designed so that multiple people can contribute to your risk assessment. And I think a good way to do that would be to save the file on a network share, or if you've got SharePoint or something like that, somewhere that is accessible from Windows Explorer for multiple parties. I think that's a great way to work on a security risk assessment. So let's use SharePoint, for example. I know that's a pretty common way that people, it's a pretty common setup. If you save your risk assessment there, you can open it from there, and one person can start on the assessment. They will need to close out. Two people can't be logged into the assessment at the same time, so that is one challenge there. You'll need to kind of take turns working on it, but so one person can be in, they can save and exit, and then another person can access that same file from SharePoint and then pick up where person A left off. It is also possible to you could send the file back and forth. You could mail it or whatever mechanism you have to transfer it. One person could start on the SRA file, and then you could transfer it to somebody else, and then they could pick up where you left off there. As long as both parties need to have the tool installed on their machine. I think that's important to remember for all of this. In order to work on the SRA file, you do need to have the tool installed. All right. Next question, should we wait to start with 3.5? A good question. I wish I had a release date to tell you. I think the best advice I could give here would be I wouldn't wait. I think when if your organization needs to do a security risk assessment, based on the resources you have now or the timeline, or, I wouldn't hold up your schedule to wait for 3.5. The output of the 3.4 assessment is going to be just as valid. You kind of saw what features are coming. It would be nice if you had access to those, but I'd say it's coming soon, but I wouldn't necessarily wait. I would keep to your if you already have a timeline for doing a security risk assessment, I would keep to that. All right. Can the SRA be installed on a flash drive or run from a flash drive for portability? No, there wouldn't be a way for that to happen. The tool installs to program files, and it's not really set up for portability like that. I don't know. Maybe somebody can make it run portably, but I don't think. It's not really designed to do that. Uh, let's see. Do you have to complete all the assessment in one session, or can you save your work and continue at a later time? Um, and is the information only visible and available to the individual completing it, or does everybody else have access to the information? Okay. So yes, you can definitely start on your assessment, and given the amount of effort that's expected to go in to your assessment here, I think that's a perfectly reasonable way to go about your assessment. You may take multiple days to do this, so you may save it and walk away, or go home for the night and then pick up again. So that's definitely possible. And as so long as you're working on the same assessment, so you're working on the same SRA file, then it's designed so that everybody's work is visible. I mean, you're all multiple people are contributing to one risk assessment. So yes, it's if you answer questions, it's visible to anybody else that you send the file to or who has access to the file. I don't know. I mean, I do have several more questions here. I don't know if there was anything that you wanted Nick to address.
Yeah, I do actually. Nick, I think you've probably seen them, but I think the high level question is how long must you retain the SRA and how often do you need to do the security risk assessment? We're kind of top, and then I didn't know if you had a couple others that you wanted to answer.
Sure. I just put a thing in the Q&A responding to that question about the retention requirements. So the rule has a retention requirement at 45 CFR 164.316 B2 rubbing that I. So basically it says that documentation that's required by the security rule, of which the risk analysis documentation would be included in that, must be retained for 6 years from the date of creation or the date last in effect, whichever is later. So really, there's a 6-year, window for keeping that kind of documentation on hand. And there were a couple other questions on here that just kind of go back through some of these, maybe more for some of about the program itself, about, for maybe for Alterum. I mean, there was one about a question about modifying the actual program if there are areas of focus not currently covered by the tool. So Ryan, I think you talked about that, about the ability to, and I think I may have put something similar in the chat in a different kind of question, but about, using the freeform text boxes to talk about things that aren't in the tool, about linking extraneous documents that talk about, risk areas, or maybe for identifying technical risks that or new technology that aren't identified within the tool. So there are those opportunities to include those, to link those in, and it would be up to the individual to either aggregate those kind of risks where they make sense to be reflected in the report, or to have a more manual process and have a supplemental report to go along with the report that's generated within the tool to talk about those types of other risks. But as far as the first part of the question, can we modify the actual program? I believe the answer to that is no. Right, Ryan?
Yeah, I mean the program can't be modified. Certainly if there are suggestions that you have, whether it's questions to be covered or functionality of the tool, I'll put up our feedback form and email address here that you can send us. If you're trying to add questions, you could use the Excel workbook. That's something that the sheets in there are protected, but you can just unprotect them and you could add things to that version of the tool. But as far as modifying the tool, as a user, that's not possible.
And I think another question, and I'm not sure about this one. I'm gonna maybe see if this is more of a Alterum question, but they're asking about options to benchmark prior responses of an organization within the tool itself.
Yeah, and that's an interesting idea. There's not currently there's not a way to track, you responded this way last year and that you're updating. I'm not sure if that's what the question is getting at, but I don't think there's any functionality like that at this point in time. I mean, you'd have to just manually compare, reports from year to year, which, you could do, especially with some of the Excel exports.
Yeah, and there was a couple of questions about how often to do the assessment, and I trying to answer that a little bit. I put some a quote from and a link to our security risk analysis guidance in one of those questions. But the security rule itself doesn't prescribe a specific cadence to conducting the risk analysis. So basically, as far as updating risk analysis, that would more fall under the overall update provision for the rule itself, as far as the policy procedures and documentation requirements. And so what that talks about is about reviewing your documentation periodically and for updating it as needed in response to environmental or operational changes affecting the security of EPHI. So there's not a HIPAA prescription to do it annually. There may be other regulatory requirements to do a risk analysis or risk assessments on an annual basis. Maybe if you're doing CMS and MIPS macro, that may have a more specific cadence for that. The security rule does not, but the security does require there to be that periodic review and to make sure that it's reviewed and updated as needed in response to those environmental operational changes that are going to affect the security of EPHI. And like I said in a prior question, I put a quote in there, a little discussion around this area from our risk analysis guidance. So maybe just kind of going back, see if we can do another question.
I think we've only got about a minute left here.
A minute. So that's another question about how often to do. So I think we just took care of that. So there's a question about sample policies, procedures, standard operating procedures for deficiency areas. Our current vendor has hyperlinks. So I don't think there is details as far as actual policy procedures and SOPs, but Ryan, maybe you can talk a little bit about, and I don't recall how detailed you went into it in the presentation itself, but I think that there are kind of best practices that the tool tries to guide you to in response to your questions.
Yeah, the tool, I mean, I think the education content does kind of nudges you in the correct direction. I think the best place that you could go, at least from the tool, to get some more, a little bit more prescriptive actions that you can take would be to use those references, especially those hiccup references. I think there's some better guidance there. But I think that's all we have time for questions right now. We're at the 4 o'clock Eastern. I do want to put up our, so we do have this email address here. If we didn't get to your question, if you still have questions, you can use this SRA help desk at altarum.org. There's also on the healthit.gov download site, there's the Health IT feedback form. I think it's somewhere around the bottom of the page. You can find that, and you can submit questions that way as well. So yeah, that is all we have for you today. We really appreciate you joining to learn about the SRA tool. And again, please let us know if you have questions or feedback. And that's it for today. Thank you.
Okay, thanks. Bye.